yang belakang alasan dripnya terakhir. Ya, saya tidak kadang hal seperti ini sepele ini tapi tidak diperhatikan kadang. Ini kan bukan pelajaran edukasi ya kalau YouTube ini.
This cat has some beautiful mammary development. So one thing that may end up happening in this cat is I may accidentally get those mammary glands in the towel clamps, and we may see a little bit of oozing of sterile milk. That's not the case. But milk seromas will go away. Now, if we can, we will try to cover the tray with the drape. Once again, if the drape is not properly folded, this can be a difficult thing to do when you're working by yourself. It's best to have a partner unless you folded the drape properly. Cover up the instrument table. Then I'm going to lay the instruments on top. Count our sponges. 1, 2, 3, 4, 5,
Nah, ini kenapa harus
6,
dihitung?
7,
Ya, tadi harus nanti takutnya dimasukkan tidak sesuai dengan yang kita siapkan ya.
Then we'll load our blade. And it's best to use a needle holder to load the blade handle so that you don't accidentally lacerate your fingers. Slide that in the groove. There we go. All right, now here's umbilicus, and I'm going to palpate pubis. In the cat, the incision is the middle third of that distance between umbilicus and pubis. So in a cat, the incision is middle third. So the first thing I'm going to do is stretch out that skin, and I'm going to cut it. So now I've cut through the skin. I'm going to gradually make my way down.
Ya, jadi kalau mau mengincisi tangan kiri itu selalu meregangkan seperti ini. Ya, jangan tangan kirinya nggak usah pakai alat apa kayak pinsetnya. Pakai tangan ini diregangkan seperti ini ya. Nah, ini tadi pesannya, nah ini dia pakai artery clamp.
Parallel.
Boleh pakai artery clamp, boleh pakai gunting Metzeburg ya.
Mammary tissue to either side. Normal cat, that wouldn't be necessary. Now I can pick up that subcu tissue and the mammary tissue, and I can spread it further. Here we go. Now you can see mammary glands right there, and the midline that separates those mammary glands. And that underneath is the external rectus sheath. Now in a cat, the external rectus sheath is pretty thin. There might be a very, very, very fine layer of fascia over the top, but otherwise the subcu fat is not attached to it. The linea is also very, very narrow. And so sometimes it's easy to miss the linea. I tent it up. I'm going to make a small incision through that linea. Since this animal is thin, I can extend that incision with my Metzenbaum scissors. Now we're in the abdomen. Notice that the cat has a lot of fat on the inside of the abdomen. In fact, it's very hard to see that you're actually in the abdominal cavity compared to a dog. That's the bladder underneath. In a cat, I'm going to use the spay hook, and I'm going to angle the spay hook slightly cranially. Follow it along the body wall, slide across the dorsum of the cat, turn the hook towards midline, and pull slowly and gently straight up. If there's a lot of resistance, I don't want to pull up. Here, I see a lot of fat right here, and I don't know whether this fat is broad ligament or round ligament of the bladder. And so I'm going to try and look at it and identify it. If I'm not sure what it is, then I'll go ahead and use the spay hook again. Grab the body wall, turn the hook sideways. In the cat, angle the hook cranially, in the dog caudally. Sweep across the dorsum of the cat, bring the hook toward midline and pull slowly and gently straight up. Now lift off whatever is on the hook to see if you've got broad ligament entrapped underneath. In this particular case, that's omentum. It doesn't have very much blood supply to it. So I'm going to hang on to that omentum. I'm going to slide in once again, sweep across the dorsum of the cat, turn the hook toward midline, and pull slowly and gently upwards. And now let's see what's on the hook the next time. This time, there we've got some colon on there, and then more omentum. This is probably the hardest part of the cat spay, is actually grabbing the uterine horn. And if we can't grab it easily, we're going to extend the incision line. Once again, I'm lifting up. I'm going to slide the hook dorsally across the abdomen. I'm going to lift slowly and gently straight up, and then I'm going to lift the omentum off to see what's underneath. This time, we've got uterine horn. So now I'm going to put a clamp on the proper ligament. We're going to grab our 3/0 monocryl. Here's the ovary in the cat, and notice how in the cat the ovary comes way out of the abdomen. A lot of times we don't have to strum the suspensory ligament. One way of strumming a suspensory ligament in a cat is just to pull caudally and to press down on top of the drape and actually stretch the suspensory ligament right through the skin and the abdominal wall. That's particularly helpful if you've made a small incision. The other option is to take your finger and slide it as far cranial as you can on the suspensory ligament, and again, just press downward. In most cats, you don't need to break the suspensory ligament to get the ovary out of the abdomen. So we've got great exposure. Now I'm going to make a window next to the uterine vessels, and I'm going to put a clamp on. In a lot of cats, we only have room for 2 clamps. They're pretty tiny, so it may not be necessary to use a 3-clamp technique. If you do use a 3-clamp technique and you don't have a lot of space, the 3rd clamp can go up and across the uterine horn like this. Now we've got our 3/0 monocryl. I'm going to use that for ligating ovarian pedicles. You can actually do a 1-pack spay in cats with either 3/0 monocryl or 3/0 PDS. Once you get good, it'd be nice for you to be able to save a little bit of suture material. Just use a single pack. I'm going to bring the suture material underneath all the clamps. I'm going to tie a surgeon's throw here. And as I tighten down, I want to make sure that I lift up on the pedicle so that the ligature is a good distance away from the clamp. That way, that clamp will crush down properly. 4 throws should be sufficient. Cut the ends so they're about 3 millimeters long. Now the second ligature, I'm going to place in the crush of that clamp that's on the bottom. So here we'll see this. Grasp the suture with the needle holder, pull it back through the window. And here, what I can do is place it across the clamp and then just remove the clamp and tighten down. Now that ligature has fallen into the crush, and it's quite a distance away from the other clamp, and so it should crush down very nicely. 2 ligatures are in place. Now remember, we're here to take the ovary out. So when you cut with a 2 or 3 clamp technique where 2 clamps are below the ovary and 1 is above, you need to make sure to take the ovary out with the uterine horn. Leave a little bit of a tissue stump here. Grab the edge of the tissue, but don't lift up. Open the clamp and take a look. If it's bleeding, slam it shut. If it's not bleeding, so release the tissue. To find the other side, grab the uterine horn and pull forward, up, and back. And the other horn will pop out, particularly if your incision is in the middle third. Once again, I'm going to identify the ovary and uterine horn and put a clamp on the proper ligament. So you can see the ovary is pretty far out of the abdomen. I actually don't have to break the suspensory. If I wanted to stretch it a little, I could press straight down on it, right through the body wall. And now it's another centimeter or two longer. I'm going to make a window. Get that omentum out of the way. So make my window, put a clamp across the pedicle. I'm just using a 2-clamp technique. I can place the clamp above and below the ovary. With the 3-clamp technique, if I've got space for that, I can put a second clamp between the ovary and the body wall. Now we're going to go ahead and ligate again. Pass the needle holder through the window, grab the suture material, pull the suture material below both clamps, tie a surgeon's throw. Now here I've got a little bit of omentum in that ligature. So what I'm going to do is I'm going to use my finger to pull the omentum down as I use my opposite hand to lift the clamp upward. That was the surgeon's throw. I'm going to finish tying, and as I tie, I'm pulling parallel to the clamp. Second ligature, I'm going to place it in the crush. So I can either remove this clamp right now, or I can wait until my ligature is around the crushed area. Release that clamp and drop the ligature down into the crush. Most cats do not need a transfixing suture of their vascular pedicles. You might tear the vessels if you're using a transfixing pattern. Again, we're going to make sure we leave the ovary with the uterine horn. If you don't have enough space, scooch that bottom hemostat down a little bit so you can make sure you're getting all of the ovary right there. Now both ovaries are out. I grab the tissue with my thumb forceps and I hold on to it. I release the clamp and take a look. No bleeding. Let that go. Now, to get this uterine body out of the abdomen, what we need to do is we need to break that round ligament of the uterus. It's very small in cats. It's just this tiny band right here, but still it's very strong. And so again, I want to make a window between the vessels and that round ligament, and then I'm just going to pull that up and out of the abdomen. Same thing on the opposite side. On this side, you can actually see the vessels a little bit better running there. Here's the round ligament of the uterus. I'm going to make a window in between the vessels and the round ligament. I'm going to pull that round ligament out of the abdomen. Pull the uterus forward, up, and back. And now it is outside of the abdomen. For a small uterus, you can do 2 encircling ligatures. The other option would be an encircling and then a transfixing. In cats, I do not try and find the cervix because the ureters are sometimes very, very close to the cervix in cats. So we want to avoid getting the ureters. And so what we want to do is go somewhere between 1/2 and 1 centimeter below the bifurcation. So here I'm going to pass suture around. I'm going to do my surgeon's throw. I'm going to crush the tissues, 3 additional throws. I'm going to cut the suture. Then if I want to add an encircling, I'll actually put that above the ligature, encircling ligature. So between the encircling ligature and the uterine horns. Pass the needle through the middle of the uterine body. Do 2 simple throws. And I'm going to pass it all the way around. Now take a look at what's happened here. Do you see the crushing and the tearing that's occurred the transfixing suture pattern. And that's the risk in an animal that's in heat or has friable tissues for some other reason, such as a pyometra or a recent pregnancy. And with these mammary glands, one would assume that this cat has some very friable tissues. So because that tore, I'm going to be safe, and I'm going to add a third ligature so I can sleep tonight. Notice that I didn't clamp the uterine body. If I had clamped this uterine body, it would have torn just like when I ligated it. Now we're ready to remove the uterus. You can put another clamp to stop blood from flowing backwards. I'm going to grab the uterine body, the thumb forceps, and I'm going to cut in between the thumb forceps and my uterine horn clamp. I'll look at the tissues, and then I'm going to release them. Now we're ready to close. I'm going to close this external rectus sheath with 3-aught PDS. Again, I can use my needle to lift up on the sub-Q fat, pull it out of the way so I can see the external rectus sheath. Cats are very stretchy, so you should be able to pull the external rectus sheath right up and out of your incision line. There's a nice wide bite of the external rectus sheath. In some cats, if they're very thin, you may be going full thickness, but in most cats, you may be able to take just the external rectus sheath in your bites. We're going to oppose this tissue. If there's a lot of tension, use a surgeon's throw. Otherwise, a single throw is fine. Don't necrose it. So we don't want to crush the tissues. I'm going to cut the ends short. Now we'll do a continuous pattern to the opposite end. It's a pretty small incision. Make your incision a little bit bigger so you can see what you're doing. Let's get that little suture end out of there. Okay. If you're unable to take both bites at the same time, that's fine. Grab the sub-Q fat and pull it out of the way so you can see the external rectus sheath, and re-grab it with your thumb forceps so you can stabilize it with your thumb forceps. You can use your needle as a retractor. The bites are going to be about a 1/2 centimeter wide and about a 1/2 centimeter apart in cats. Bite size is all dependent on the size of the animal. If this were a ferret, then my bites would be about 3 millimeters apart. And there's external rectus sheath, and there's muscle, which I don't need to get. Yes, that would be great. We're going to do a splash block on this cat after we've got the external rectus sheath closed. I keep palpating along there to see if there are any additional defects. See, here's the very end of the incision line. So in cats, they're very stretchy. It's easy to pull this tissue out of the abdomen. Just need to be a little careful because you don't want to cause a lot of trauma. When you're tying to a loop, pull gently and firmly, open up the jaws of the needle holder, and pull the throw down so it goes directly over the incision line. Pull the loop through, pull the throw down so it goes directly over the incision line. This will force you to pull harder with your non-dominant hand, and it'll make a square throw. Now I'm going to make a 1/2 hitch on purpose. That's what a 1/2 hitch looks like. It stands up. To make the 1/2 hitch square out, I'm going to pull harder on the long end and pull less on the loop end. I'll make sure we don't have any 1/2 hitches. And we'll cut the suture. And we're ready for our splash block. On this cat, I'm going to do a sub-Q to intradermal closure. Now, if the mammary tissue is more developed than this, I would avoid a sub-Q because I wouldn't want to be putting holes in the mammary tissue. I'm going to show you how to do a subacute intradermal closure so that your intradermal burial is easier. So you can start your subacute how you would normally start it by taking a bite all the way across the incision line, or you can bury that subacute stitch. And as a right-handed surgeon, I'm going to start at the cranial end. I've decided to bury it just to give myself practice, deep to superficial, superficial to deep. I'm going to pull lengthwise.
Ini adalah jahitan bridge suture ya.
Then I'm going to leave this end long. And if I want it to stay out of my way, sometimes I need to put a hemostat on it. That is going to be the suture that I tie back to when I finish this closure. Now I'm going to do a subacute closure. Simple, continuous pattern. If I had a really long incision in a dog, I might do a running horizontal mattress. But in cats and in dog space with short incisions, you can just do a regular, simple, continuous pattern. And this is 3/0 monocryl, which you can use in any size dog and in most cats. And I'm going to do a simple, continuous pattern all the way down to the end. Now, on these nice short incisions, I don't bother to stop and tie a knot. I go directly back into an intradermal pattern, trying to handle just the subcutaneous tissues so that I don't cause a lot of bruising. Taking nice long bites that are parallel to the incision line. And make sure that those bites are overlapping. As you can see, this incision is pretty short, so it's not going to take too many bites to get to the end. And now I need one more bite from superficial to deep. I can take that on either side. Since I'm very close to the end, I'm going to take it right at the tip of the incision line, and I'm going to come up in the gap of the incision, hopefully. And it looks like I'm going to need to palm my needle holder to get this last little bite. Now I want to make sure that the end that I'm tying to comes up next to the short end that I've already left. Single throws, pulling lengthwise. Four throws. And in this particular case, I actually don't have to do the tucking maneuver because the knot is buried, but we'll do it just for practice. Reload the needle, palm the needle holder, turn the tip straight down, find the gap in the incision line next to the knot, and come up and out the incision line. Since there's mammary tissue, I'm going to try and come up and out the midline. Pull the knot under and cut the end short. Here's the final appearance. Let's see what that looks like.
Oke, sudah